meeting for Health, Human, and Social Services. With that, I need a motion to approve last month's meeting. Supervisor McDevitt, second by Supervisor Leggett. All those in favor?
Aye.
Carried. Okay, with that, we'll turn it over to Chris.
Why, thank you. It looks like I have a lot of items, but some of them I think will be really quick. A lot of them are pretty pro forma. Others are a little new and different, and I'll go through that when we get into them. The first one is a request to amend the county budget to add Trade Act funding. This is probably the last of the GE workers from a couple of years ago. It's $3,500.
All right, someone like to make the motion? Supervisor Bramer, second by Supervisor McDevitt. All those in favor?
Aye.
Opposed? Carried.
The next one is a new item. In the past, if you recall, we have had a resolution to sign an agreement to run the youth program. And under the Workforce Innovation and Opportunity Act that was passed a couple of years ago, they've changed the oversight structure. So we no longer need one for the youth program, but we need one for all of the programs. And this would be an agreement between the Workforce Development Board and Warren County. The agreement's being drafted and will be passed on to council when it's ready.
All right.
Can you talk to, I'm sorry,
Sorry,
could
Claudia?
you speak to number 3 as well? That's all.
Yeah, number 3, actually the last time we did number 3 was in 2015. It's a similar agreement, and in here the actual document is attached on page 6. This is the actual document that the chairman would sign, basically saying that we're going to meet all the program requirements. But they are separate
I was
resolutions.
going to say they're separate, so let's go back and act on number 2 then first. Would someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Leggett. All those in favor?
Aye.
Aye. Opposed? Carried. Now we'll go on to number 3.
Yeah, number 3 is to authorize the chairman to certify the local plan. The local plan is being developed. Once it's created, there will be a public notice posted. We will have copies here in the clerk's office as well. And the workforce board will be adopting it at the October meeting, and it will be enacted at the end of November. But I didn't know if I was going to need a meeting next month, so I wanted to get it on the agenda for discussion.
All right. Someone like to make that motion? Supervisor Bramer, second by Supervisor Leggett. All those in favor?
Aye.
Aye. Opposed? Carried.
The next one is a request to execute an agreement with the Council on Prevention. Back in May, we did a little demonstration program where we brought in the Council on Prevention to do leadership training with our youth. And these were the youth that were in our GED class. And what we'd like to do that again for the course of the year. The total of the contract would be less than $3,000, so it comes under federal regulations as a micro purchase. There's no proposals required, but since there would be an agreement executed, I thought it would be best to bring it before the committee for discussion and review.
Any questions?
How many people are in the GED classes usually?
We had 12 on the first class on Tuesday, which is a really good number, especially for the first class. Because kids come and go. You come in and once you're prepared, you can take the test. There's no requirement. There's no training requirement in order to sit for the course. So it's really up to the individual person, when they feel they're ready and when the teacher feels they're ready. So 12 at the beginning is a good number.
Good.
And then they would all get this training, this leadership training?
Yeah, they would. Yeah. We actually will tie it into what we did last May is the GED class is on Tuesday and Thursday afternoon. And what we did is we brought the council in on Tuesday or Thursday morning for an hour and a half, right before the task class.
All right. Someone like to make the motion? Supervisor Bramer, second by Supervisor McDevitt. All those in favor?
Aye.
Opposed? Carried.
The next one is another new item under the Workforce Innovation and Opportunity Act. We are required to offer 14 separate program elements to any youth who enters into the program. And under the new act, we're required to have a memorandum of understanding with each of those referral agencies. And no money would be exchanged, So I'm not sure if it really requires a resolution, but I did want to bring it to the committee for discussion. I don't know if council has a thought or opinion on it. But these would be referrals to places like the Housing Authority for Housing, the Waite House, Adirondack Health Institute and Hudson Headwaters, Catholic Charities, Salvation Army, Access VR, or Northeast Career Planning, just as an example of some of the agencies that we would be required to have a written agreement with.
The attorney said, yes, we need to do that.
Okay.
Okay, so if someone would like to make that motion? Supervisor Leggett, seconded by Supervisor Bramer. Any more discussion?
So these are MOUs that would be drafted up as needed?
Yeah, and my understanding, we're regulated by the New York State Department of Labor, and my understanding is that they are going to provide a sample agreement. It'll just be a 1- or 2-page agreement, and when I get that draft, I'll run it by council.
All right, all those in favor? Aye. Opposed? Carried.
And then the final item is one, that comes around every 9 months, a request to host a meeting for the Workforce Development Board. This would be scheduled on December 13th. I'm not sure yet if it's going to be a morning meeting as usual. There had been some discussions that it might be in the afternoon. But when the time is in actual location is scheduled, I'll let everyone know.
Okay, thank you. Any committee members have any questions, concerns? No? Anything else, Chris?
No, just I mentioned to a couple of people in the hallway, we've wrapped up the summer program.
Right.
We're putting together the final numbers, and be happy to send everybody a report on.
Oh, that'd be great. We'd appreciate that. Okay, thank you very much.
Thank you.
Have a good day now.
Veterans.
Good morning.
Here we go. Morning. Oh. Sorry.
All set.
Okay. Good morning, everyone.
Morning.
Good morning.
We have two action agenda items on here. Review of the department 2018 department request for budget and request for a new position.
We're going to start with the budget then, Denise, and
Sure.
kind of briefly give us an overview or tell us where...
Okay.
Okay.
Let's see here. Not much has happened with my budget. There was a reduction in my contributions and other payments by, I believe it was around half, so $1,500 reduction due to product description of bronze markers. Our foundry went out of business, so we decided to search around for new and improved products, so we switched to aluminum. That's bronze coated.
Right.
And that incurred a cost reduction of cutting that budget line in half.
Great. Committee members have any questions?
So,
Yeah.
equipment this year? plans?
I do not
Oh,
have
no,
plans.
sorry. That's, yep.
I should be all set on equipment, I believe, for right now. The only other, there was a $200 increase into my supplies, because year after year, we end up moving money, so I just increased it by 200.
Okay.
There are really no other changes.
Right. Claudia?
Thank you. I saw that you have a request for a new position. Is that included in your budget?
It is not included in the budget, but there is no change to the salaries. It's, so my 3 drivers work on a part-time basis, hourly, so if they don't work, the money is not used. So I'm just taking a portion of each of their salaries and moving it into this 4th position. So it's already in there right now, it's not going to change the budget at all. It's a per diem slot?
Just so you have 4 drivers?
Yes,
Basically?
yes.
Okay.
I have one out right now, so I've had to drive
Right.
periodically.
Okay.
And, that's really not in the best interest of the department or the county.
Right,
So,
right.
by incorporating this per diem driver, that person would be on call. So if those other 2 drivers that are now driving could not drive, then this per diem driver would drive in their place.
I think it's a very good idea, and it certainly relieves her from having to drive, which I think she's more beneficial to us to be in the office processing claims
Right.
and all. So, now,
Not that I don't like a field trip.
Oh, I'm
here
sure.
and there,
Joanne, on the first item here with the budget, is there anything we have to do? I mean, she's reviewed it with us, but we don't have to act.
You don't have to act on it.
Okay, so what we really need to look at then is the request for the new position?
That you have to act on.
Okay. Claudia,
I'll make that motion.
second to the motion? Supervisor Leggett, any more discussion? All those in favor?
Aye.
Opposed? Carried. Anything else, Denise?
No, I think that's it. The only other thing I want to mention, since the commissioner's here, that, Ms. Schmidt and I do plan on meeting, but I think we're going to push it out to the middle to the end of October, just because it benefits for both of our schedules. But we do plan on meeting with council, on some kind of resolution to, maybe fix some areas where communication can be a little more freely between the 2 departments.
Okay, sounds good. I'm glad you're doing that.
Great.
All right, thank you very much.
Thank you.
Have a good day, Denise.
Thank you, everyone.
Hey,
Have a great day.
Rob?
Yep.
Thank you.
Okay, good morning, everyone.
Morning. Morning.
I think most folks know Harry Carlson is our Deputy Director of Fiscal.
Mhm.
And we wanted to review our budget at one point this morning, so Harry's along. My first item, though, is a resolution request to amend the 2017 Warren County budget to accept funds from the New York State Office of Mental Health in the amount of $18,816 for the purpose of increasing support housing capacity for individuals with serious mental illness.
Supervisor Bramer will make the motion, second by Supervisor McDevitt. Any questions? All right, all those in favor? Aye. Opposed? Carried.
Thank you. Second item is a resolution request for 2017 Warren County budget transfers. In January, we had a employee, fairly long-term employee, Cindy Watson, retired, and so our health insurance costs, we had a big bump in that this year. So Rob Lynch asked us to take a look and see what we could do within our budget. So the top portion here shows some transfers within our current budget over to retirees hospitalization, health insurance cost reimbursement, dental insurance, and we also, in our review, noticed we're running a little short on telephone, so we transferred a little over to telephone. And then in the bottom portion is the balance of what we would need that would have to come from contingency. This is at the suggestion of Rob Lynch, so he has looked at this.
All right, so then I guess we're looking for a motion. Supervisor Leggett? Are you going to make the motion, or you have a question?
I have a question.
All right, could we bring it to the floor then first?
I'll bring it to the
All right,
floor.
second, Supervisor Bramer, all right.
So, because a person retired, you filled that position, the new position took all of what you had budgeted for hospitalization and such. Now you need to up your retiree hospitalization benefit line, is that correct?
That's correct.
So, and the total of it all is all your listed amounts plus the 13,000.
Yes. Except the telephone wasn't associated. That's a separate thing. We
Right.
just kind of noticed that while we were doing this. We thought it was the appropriate time to bump that up a little bit.
Any other questions?
So,
Oh, okay, I'm sorry, go ahead.
So it's about, are we looking at $20,000 for hospitalization for the year?
Is she taking the family?
Yeah, I think she went, she stayed with the family coverage, which I think is estimated right around $20,000 a year for county costs.
And then that reduces when that retiree hits.
Well, she's required to go on to Medicare. Maybe that they require, most plans require the person to go on Medicare, and then it's reduced. By how much, I'm not really sure. We'll rely on the treasurer's office on that.
20,000, just off the top of my head, seems high.
Well, I think that's basically what we, I mean, that's what Rob came back with, it's basically a $20,000 increase. And I remember when I was trying to figure out some of the fringe benefits to the persons that have been there a while, it seemed to be right around $20,000. I mean, you can't double check for the treasury, but that's what, I seem to remember right around there. Yeah, family coverage is really expensive.
14.
I mean, again, a lot of this, we're just relying on the numbers from the treasurer's office.
Just a quick question, from the perspective of kind of accounting and retiree, is this done typically over anticipating someone's going to retire, say in the next 5 or 6 or 10 years? Is money budgeted typically on a pre-annual basis, so to speak, to account for that, or are we waiting for the employee to retire before we, throw that money in the pile, so to speak?
Well, in this case, I was after she retired. I mean, I was really unsure exactly how the retirement hospitalization was calculated, and again, relied on the treasurer's office. So I must admit, I was quite surprised when it was the full amount. They just transferred the full amount of their insurance coverage over to the retiree. But, that's the policy of Warren County, I guess. Got to live with it.
Thank you.
Mr. Leggett?
How are we doing in our contingent account?
Yeah, I was just going to ask, because, so we're looking at the top amount you found money within your department to make the transfers, right?
Right, that's within current approved budget amounts. That's just transfers.
All right,
The
but that-
bottom
that-
portion is the contingency,
Okay, so
13,000.
I guess, we have to go back to Frank then. Right, have to go to finance, I understand. That way they can. And then they can make the decision, they'll then come back to Frank. Okay, so then, that's what'll happen, it'll have to go on to finance for them to make the final decision. But we can, make a motion saying we're in favor. Pass it on to finance. Right, okay. So we made the motion, seconded, if it's approved, then we're going to, or part of the motion, I guess, then we will pass it on to finance and let them make the final decision. Okay? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, then also in your packet, you should have a copy of our 2018 departmental budget request. Materials that we have submitted. For the most part, we have held our state agency contracts flat, except for where we've had opportunities to accept 100% state aid. For our office department, our administration, we have tried to hold all of our lines flat except for our rent. Our rent has a built-in 2% increase annually. So we did have a 2% there, but otherwise tried to hold our lines flat. We do have some additional revenues that we recognized from district funding of $16,000, and we don't expense that separately. We just consider that an offset to the county's cost for our office.
Supervisor Bramer, you have a question?
On the, let me get back there. Alcohol prevention education program, that has gone up significantly. Is that as a result of state aid being received as well? Okay.
And that is 100% state aid, state and federal.
To begin with. Okay, thanks.
You know, the state's been recognizing more and more, opportunities to secure funding to address heroin and opiate addiction crisis, and so we've been trying to channel those funds to the Council for Prevention. We've been doing a lot of work in that area. We did cut some of our consulting line. We've had a consulting line of $7,000 that we, in our budget meeting, discussed reduction there, so we did cut $3,000 out of that line.
Any questions from any of the committee? Peter? No? Anything else? Craig?
No.
Claudia, you're good? Hey, thank you, Rob.
Okay, thank you.
Thank you. That's a big packet. Oh, that's with all those budget things. She got her budget in here. Yeah, it is, isn't it? It's too small. Oh, they just put the summary in. Yeah, that's fine. That was just as well, don't you think? Yeah. Actually, I think we told them. Departments, yeah. Yeah, good. Okay, I guess Maureen, we're all set.
Okay.
I wasn't sure Claudia was still there, that's why I was looking.
It looked like she was going to go.
Right.
I'm hanging in there, guys.
Good.
Good morning.
Good morning.
Our first request is to fill the vacant position of Social Welfare Examiner 21, employee number 12538, and the salary is $34,318, grade 8, step 2, effective August 18, 2017, due to termination. This position is mandated and reimbursed.
All right, motion Supervisor Bramer, second Supervisor McDevitt. Any questions? All those in favor?
Aye.
Opposed? Carried.
The second request is to fill the vacant position of Social Welfare Examiner, employee number 12436, salary $34,909, grade 8, step 3, effective September 11, 2017, due to promotion. This welfare examiner was promoted to caseworker. So
Okay.
we're pleased to be able to do that. This position is mandated and reimbursed.
All right, good. Someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Bremen. All those in favor?
Aye.
Opposed? Carried.
Number 3 is a request to fill the vacant position of keyboard specialist. Number 4, employee 12981, salary 26585, grade 3, step 0, effective September 11, 2017, due to promotion. This keyboard specialist went up to being a caseworker also. They have the background, took the test, did well, very well.
Good, okay. All right, someone like to make that motion? Supervisor, sure. Supervisor Leggett, seconded by Supervisor McDevitt. All those in favor?
Aye.
Aye. Opposed? Carried.
Our next request resolution is to create and fill the position of senior caseworker, grade 18, salary 44,101, effective October 23rd, 2017. The rationale is to ensure that case processing timeliness complies with state regulations.
All right, someone like to bring that motion to the floor? Supervisor Leggett, seconded by Supervisor McDevitt. So I take it you're in the process of looking for someone then?
Yes, we have a list, and actually, because we just filled a vacant one, we have interviewed everybody. So if this goes forward, it will hopefully quickly happen, and then we can get our timelines. What happens is we have so many people funneling into only 2 CPS seniors, and work gets held up instead of finished because they have to review everything to make sure that everybody attended to everything that they were supposed to during an investigation.
Right.
So we figure moving someone up, that if there's 3 people, then we'll get things through and we'll meet our timelines for the state in a better way.
Okay, sounds good. Supervisor Bramer?
Thanks. Are we planning to delete then a position under this?
We were thinking of, yes, the senior going up and not replacing that caseworker that will be promoted.
Right. Any more discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, and our next one is regarding resolution number 321 of 217, which amended the table of organization and Warren County salary and compensation plan for 2017. It was approved at the September 15, 2017 board meeting, requesting authorization to ratify the actions of the chairman pertaining to the approved pre-post committee request to change the date which deleted the resource assistant from August 21st, 2017 to November 21st, 2017. And this position is mandated and reimbursed. This came about because we were trying to get a new position, change that title of the person that was the resource assistant. And because we haven't had an opportunity to fill that, I needed to call back our resource assistant who had retired to fill in, because what she's there, and we're getting things done and collecting money, because that's what the resource unit does. So I didn't want to leave it open indefinitely and hold up bringing in some money. And we just, when we deleted somebody we still needed, so that's what it was.
Okay, someone like to bring that to the floor? Supervisor Bramer, seconded by Supervisor Leggett. All those in favor?
Aye.
Aye. Opposed? Carried. Did you have a question?
Well,
Go ahead.
just to be clear, it was deleted, it's reinstated, and this is to ratify an action that the chairman's already taken.
Yes. And now we can turn it over to Edward.
Okay.
Okay, thank you.
Good morning.
Good morning.
Okay, I have a couple of request resolutions today. The first one is we're asking for permission to create and fill the position of institutional aide number 16 and delete the position of institutional aide number 4. This change would increase one current staff from 32 hours a week to 40 hours a week, and the reasoning behind that is to retain the staff, the good staff that we have currently. The additional hours would be offset by the deletion of one other part-time aide position.
All right, someone like to bring that to the floor? Supervisor Leggett, second by Supervisor Bramer. Questions?
So now on the 32 hours, are there benefits additional to this change now, or are they already receiving benefits?
Yeah, they're currently,
But are they
The
presently...
benefits
don't change at 32 hours if they're already
They're still,
offered
okay.
benefits.
Yep.
All right, any other questions? All those in favor? Aye. Opposed? Carried.
Okay, the second request resolution is to create and fill the position of institutional aide number 17 and delete the position of aide number 4, part-time position. Again, this change would increase one current staff from 24 hours a week to 40 hours a week. And the reasoning again there is to retain our staff, and the additional hours again would be offset by the deletion of the other part-time aide position.
But that would be one where we went from no benefits to benefits, right?
That's correct. However,
Okay.
because of the needs of Countryside, they've had a one full-time aide position that has been out very long-term. We have no idea if she's coming back. And what happens is this 24-hour position is working a lot of those hours.
Right.
And if they average over 30 hours, we have to offer benefits anyway.
Right.
And it's looking like she's going to be well over a 30-hour average. She has stated that she doesn't need benefits because she has them through her husband. We're hoping
Right, that
that will stay.
Right.
But we don't have any control over that. We do have the money in the budget because the person out on workers' comp
Right.
had full benefits. So the money is in the budget for it if she should opt for the benefits.
Okay, good. Someone like to make that motion to bring it to the floor? Supervisor
bring it to the
Leggett,
floor.
second. Supervisor Bramer. Craig, you have a question?
So the position that's being deleted, or the employee that's been out will no longer be on that. What's happening?
At this point, we're not deleting that position at
Okay.
all. We're not doing anything with it at this
But
point.
you just need to cover that position, is
Right,
what you're
right.
doing.
Over that
Right.
position.
All right, any other questions?
And this is also being part of that share of deleting the institutional aid number 4.
Well, unfortunately, they're both number 4s that are going to move into full-time positions. A 32 hour is going to go to 40.
Okay.
A 24 is going to go to 40. And then as you move down, you're going to see where we're deleting a 24-hour position. So those hours that are in the budget are what's going to cover the 2 full-time, the additional hours for the full-time that we're asking for. I know it's confusing.
Okay. Any other questions, Craig?
No.
Okay, all those in favor?
Aye.
Opposed? Carried. I guess they've done their homework though, Craig. They know the money's here and going to take care of it, so I guess that's what we're concerned about.
Just trying to keep up with them.
I know, that's true. Edward?
Okay, the final request here would be to have the authorization to delete the one part-time aide position that Julie mentioned. Deleting that position will allow the hours from the deleted position to be split between the 2 current part-time staff to make them full-time, thereby retaining staff. So that's the final request.
All right, someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Bramer. Any discussion?
This is basically just the same thing we just agreed to.
Eliminating that position,
But now
right?
you need a separate resolution to delete this.
This is third position.
Oh.
We had 3 part-time positions, 124, 224, 132. So we're eliminating this 24-hour. We're giving 8 hours to a 32-hour position, giving her 40. The remaining 16 hours will go to the 24-hour position, making her 40, and eliminating the 124-hour.
Okay.
Right.
So we already
Currently
agreed to that.
posted, and we have had no
Third
interest.
resolution, doing the same thing we just did, but whatever.
Where,
I don't know, I'm not the council. She could tell us maybe. She wants to know why we need a third resolution
It's
to
fine.
eliminate that position, where she kind of felt like we had done it in the first 2.
Exactly.
Isn't this a third position?
It
It's
is.
another position they're eliminating.
We're eliminating 2 24-hour and 1 32-hour, and creating 2 positions instead of 3.
Right.
Okay. Okay.
We're good.
Okay.
All those in favor?
Aye.
Aye. Opposed? Carried. See what happens when you have so few people at the committee meeting? Okay.
you really need a whiteboard, diagram that all.
Okay, Edward?
Okay, thank you. Thank you very much. We do have a pending item related to a requested update for the cost analysis for our in-house laundry. So we've included that here, and we basically made the assumption that the equipment for our in-house laundry would be purchased sometime in 2018. So what we did was kind of split the cost and say that half of our laundry costs in 2018 would still come from Warrensburg Laundry, and then the other half would come from the in-house laundry that we would eventually have. So for 2018, the total cost, again, if you divide the 44.8 by 6 months, it comes about 22.4. The cost in 2017 would be the actual purchase of the equipment, about 17.6. I think it was about 20 it was budgeted, so we came in under that. The 2018 in-house laundry cost, we have itemized there, comes to $11,173 for a total of $33,600. And then beginning in 2019, after the equipment is purchased and we are doing our laundry in-house, our in-house cost estimate for the laundry will be about $23,600. So if you subtract the $33,600 from the $23,600, we'll realize the savings of approximately $10,000 by doing our laundry in-house.
Good, thank you for that information.
33.6 or 44.8?
It actually be it should be 33.6.
Contracted, it's 44.8, correct?
Correct.
And if we do it in-house, it's 23.6.
Correct.
So are you saying, Craig, it's going to be more than 10 then? Is that what you're saying?
That's right. Now, let's say it's,
It looks that way,
it
you
should
know?
be closer to 20.
The first 2 are 6 months.
Oh.
Yeah,
I'm just thinking, okay, yes, in the long run, by 2019, when it's all annualized.
Right, whenever, yeah.
Okay, and then let's see, the census report here. For August, we had 1 admission and 3 discharges. September so far, we've had 1 admission, no discharges. Currently, we have 32 residents, 31 are long-term, and 1 is a respite stay.
Claudia, you had a, excuse me, Claudia, you had a question?
Thanks. With the laundry, did we go forward with those contracts on buying the equipment?
We have them in place, and they're all set to be signed,
Okay.
pending a full board approval. So they're all set
Do
to
we
be
have to do anything with
purchased.
that, or it just comes to the...
I don't know. Well, I want to make sure that happens because we just had the discussion about because of the hurricanes and prices, and we should let those contracts and get them in place. Especially with seeing this, it seems like that's the right way to go.
So who has worked on the contracts then? Edward?
Yes, yeah, we have them.
And you're
All in
saying
place.
everything is set, ready to go, but you need to come back?
Well, there's a proposal. We
Oh, okay.
submitted, we contacted at least 3 companies
Right,
to look for, estimated costs for the laundry and the dryer. Okay, so we determined what our needs were, then we tried to fit it with the proposals, and keeping in mind, trying to get the lowest cost we could get.
Right.
Which we did. The company that was able to meet our needs and give us the lowest price came in at $17,555, which was Yankee, a company by the name of Yankee.
mhm,
Okay, so they made that offer, they made that proposal, so pending final approval from the board, we're ready to accept their offer, accept their proposal, and order the equipment.
I think Julie would like to add something.
okay. Do we have, is that how it works? You have to get final approval from the board?
No.
I didn't,
No.
Okay.
What we had done, because there was so much talk about whether we would do in-house or whether we would continue with Warrensburg because the price had gone up so much. What had happened when I was doing the 2018 budget, we weren't really sure which way to go because of the Warrensburg laundry. So we brought to you, I had talked to Rob, we had the money in 2017 budget
Right.
to buy the equipment. We wanted to bring it to the committee just to see if we were going to lean towards in-house, could we please make the purchase in 2017? So at that point, we were going to get quotes, but apparently, I wasn't a part of it, but apparently they wanted costs for the water to get a true cost whether in-house would indeed be cheaper. So Edward did get them, and this is what the laundry costs do reflect, the total cost. I mean, it is an estimate, but hopefully we're close.
right.
And I think we did show that it will be cheaper to do it in-house. If that's the case, we can move forward with the quotes. We'll do a purchase order and get the equipment ordered. I know when we talked about it, the reason why I did a 6-month Warrensburg, 6-month in-house was because we went ahead with the contract with Warrensburg Laundry,
Right.
knowing it would probably take 6 months to get in-house up and running.
Well, we don't,
Claudia?
thank you, we're not even sure we're gonna have the sewer in place by then, so
Right,
that's another.
right. So
We had decided, though, that you should order the equipment out of this year's budget. I mean, we decided that at
Yeah.
last month's meeting, right?
Right. We can move forward with that.
Right.
And I think for some period of time, did they not say that the sewer could handle it for a while? Like if we went in and we wanted to start sooner and they weren't ready to start the sewer stuff till late in the spring or the summer, we did have approval to use it, that we could use it without it, whatever. We wouldn't want to use it for a very long extended period of several years or something.
Right, but...
That we
Don.
could use it in the meantime, but it's like getting the equipment set up and then trying to hire somebody to do this at whatever hours and getting it all worked out. We figured we should give ourselves 6 months. And if
Makes
for
sense.
some reason everything comes in sooner, we just have to give Warrensburg Laundry a month notice because that's in our contract with them.
Okay.
No?
Okay, so we know what we're doing with that, then. We're all good on that, right? Okay, all right.
Okay, and the last item, I believe, is the overtime report, which I've included through September 17th.
Okay.
That's
Any
about it.
committee members have any questions for Edward? Are we good to then move on to the...
Okay, just to put it into context, how are we doing on overtime?
Well, we are exceeding last year's figure through September 17th. We have about 708 hours of overtime. Last year, we had 596. So we're running about 19 hours of overtime per week more than last year. A lot of sickness, a lot of injuries. However, I'm confident that with this change that we presented here today, that would give us, the necessary staffing and manpower, if you will, to start eliminating that overtime. Or minimizing it to a great extent.
Time will tell.
Okay.
That's how it works. Okay, back to you, Maureen.
I'm going to turn now over to Julie for our budget.
Okay.
Okay, for the 2018 budget, because there are so many and they're cumbersome, I just copied the top page, which gives an overview of how our 2018 budget came in. As you can see, the county share increase is less than 1%.
If somebody wants to know more, Julie and I would be glad to meet with them at any time. But we just thought that it was too much to really review here.
I agree with you. I think this was a good idea, and the thing is, the option is open if they want to sit down and talk to you. Okay?
Fine, that's fine. And then the current month revenue and expenditure report, I don't have any concerns. For 8 months in, we're staying on par.
Okay, that's good. All right, any questions from the committee? Oh, I guess we're good then.
Thank you very much.
Thank you, Maureen and Edward and Julie. Thank you.
On the overtime report, can you add column headings from me? So that we can see that. Oh, thank you. Each column is
Thank you. Oh, up here, the date and, okay, I'm sorry, okay, yeah?
I don't know
Okay,
if necessarily
yeah.
makes it.
Right.
Yeah.
Right.
If you can put a little
Sure.
heading, that would help.
Sure, yep, okay. We'll do that.
Chair. I need that chair because it's a file. I'm gonna get a coffee. I'll be right back. Edna, I'm just gonna grab that.
Okay.
I'll be right back.
All right. Oh, this is going to be a Huh?
I don't think I got
That's true, too. Okay. We'll move forward then. We're all set. Thank you.
First item on the agenda is we produce a monthly newsletter that goes out to all of our clients and then prospective agencies in the area as well. We would like to start advertising in this newsletter, so we would solicit the area companies, nursing homes, adult homes, medical supply companies, things like that, to put their ad in there, and then we would get reimbursement for it. So hopefully we can offset the cost of producing this newsletter. I did attach in here kind of a proposed ad size and how much it would cost for the year to
Oh,
advertise
okay,
in there.
good.
So we're trying to generate the revenue to help cover the expenses of producing this.
Okay, someone like to make that motion? Supervisor Bramer, second by Supervisor McDevitt. Any discussion?
I just want to make sure we're allowed to do this. I think it's a great idea, but it just seems a little awkward, I don't know.
You see a problem, Mary?
Did Ben get back to you?
He just said that I needed to bring it to committee before we could move forward with it. I do know that other offices for the agent, they do the same thing.
Oh, okay.
And like the Glens Falls Senior Center, they produce their own monthly newsletter, and they advertise for theirs as well.
Oh, okay, well, if it's being done, then,
And we could contract with an agency to do it, but we would still have to produce the newsletter ourselves, so we figured we might as well just do it in-house, continue and get the funds for it.
right. Okay. All those in favor?
Aye.
Opposed? Carried.
The second item, we have transportation contracts with different towns throughout Hamilton and Warren County to provide transportation for social events, shopping, going on day trips, things like that. Currently, we do not have one with the town of Wells, but they have asked if we could include them as well. So what I did was, what the proposal is to include the town of Wells at an amount of, it was $750 a year, but so that the overall contract amounts wouldn't go up, we're going to reduce all of the other contracts underneath this funding source by $50, so that it wouldn't have an impact on the overall budget.
Oh, okay. All right. Someone want to bring that motion to the floor?
I'll bring it.
Supervisor Bramer, second by Supervisor McDevitt. Question?
Yes, thank you.
Mm-hmm.
Why do you feel like we need to reduce the other lines? Like, can't we just charge Town of Wells and bring in more revenue, that much more revenue?
We don't actually charge the towns, we just give them a certain amount of money, and then they utilize it for the social events. We get the funds from the state. The state funds would not go up.
Okay.
They would stay the same. So in order to prevent the overall budget of ours from going up,
Mhm.
we decided to reduce the other ones. I mean, I could do it that way if you wanted to, but
Can we ask the state if we can have more money to cover Wells? And obviously,
Dream on, Claudia.
dream on, but we could, but at this time, I don't know if they would. We've actually had some cuts, which we'll go over in our budget, that have had an impact. So we can solicit and try to get more funding, and I will absolutely do that, but at this time, I don't foresee that happening.
Okay, yeah.
and is this then for 2018? I just don't want the towns then to be surprised in the middle of this year. that-
Yes, no, it would not take place until next year.
Okay.
Yes.
All right, thanks.
All right. Any other questions? All right, although, Craig, are you good?
Okay on this one.
Okay, all those in favor?
Aye.
Aye. Opposed? Carried.
Okay. And the next item is the state gives us funding for Title III-D health promotion services. Typically in the past, we've used it to do the blood pressure clinics for Warren County. However, the state is now requiring that it be evidence-based, so you have to go to specific training and be, kind of have a license to do it. So we have reached out to SAIL, Southern Adirondack Independent Living Center, and we have reached out to Hamilton County Public Health. They both have these 3D chronic-based health promotion programs. So we would like to enter into contracts with them to provide them to the residents of Warren and Hamilton County. The overall total would be $2,245. However, the county is only required to pay for 10%, and half would be Hamilton, half would be Warren. So the overall increase in our budget would be $225, and the state has asked that we get these programs in place because we have not had them for the past 3 years.
All right. Someone like to make the motion? Supervisor McDevitt, seconded by Supervisor Leggett. Any discussion?
So these are things we had been doing, the blood pressure, and now we need to contract so that it's trackable or certifiable or whatever.
Yes, we still do the blood pressure clinics, however, that funding now comes out of CSE instead of 3D. because we're not able to take it out of 3D funds. You can only do these certain programs, Tai Chi for arthritis, chronic disease, pulmonary, something or other like that. It's a big, long name. So we have to use these certain programs now and for the funding. And we've missed out on the funding for the past, like I said, 3 to 4 years because we haven't had these. And the state is really asking me to this year to get them in place.
So this would be an expansion of services. There'll be
Yes.
more available
Yes. Mm-hmm.
clients.
And the purpose of these specific programs is to reduce hospitalizations. So the blood pressure clinics weren't really trackable to see if they reduced hospitalizations, where these are more focused towards it.
Thank you.
Any other questions? Right. All those in favor?
Aye.
Aye. Opposed? Carried.
The next item is we had our annual senior picnic up at the Fish Hatchery this past, I think it was September 13th. We had close to 250 people that came. So I just wanted to thank all the entities that helped us out with that. DPW, the Fish Hatchery, Cornell Cooperative Extension, Countryside Adult Home, the Bolton Meal Site, and the Lake Luzerne Meal Site.
That's a good turnout, huh?
Yes.
Yeah.
Great.
And we had the music this year and prizes, so hopefully next year it'll be even bigger.
Wow. Good. Good job.
And then the last item is our budget review. It's kind of complicated because we reduced our funding, our budget codes, instead of having like multiple ones, to just those two, Hamilton County and Warren County. So it's kind of hard to read those forms. Overall, our budget did go up over $200,000. It wasn't because of expenses. If you look at this sheet, and it's a front and back, so it would be kind of like the second to last one that you have. And if you look at the back side, if you look at our 2017 amended and 2018 estimated columns, they're about the same. The only increases are with the health insurance benefits and the salaries. However, our state funding has decreased, and that's the last sheet, this one here. We saw, well, actually in 2018, there is no longer going to be the Direct Care Worker Program. The New York Connects Expansion and Enhancement, the BIP program, from last year to this year, it was cut in half. So with these two programs, it wasn't used to increase our services, it was kind of used to absorb some of the existing costs that we had. So overall, our increase is mostly due to the reduced funding that we're seeing from the state. And I do not have the 2018 numbers yet because we don't have them from the state. We do have a third budget review meeting tomorrow where we're going to go over possible cuts or ways to save those costs.
So you're looking at a reduction from the 1.4 million?
Yes, we're looking to reduce that, the county's expenses, yes.
Questions, Claudia?
Thanks. On the summary sheet where it talks about the 400 contractual for 2017 adopted, we have 81,000. Amended, it says 341,000, and then for next year it's 356. What is going into that?
All the 400s, that's your rent, utilities, any of the contracts that you have, our food costs, transportation costs, like the mileage reimbursement that we do, all of those are the 400s.
So
What's
that
in the-
$260,000 was amended in 2017.
What was that?
So we increased the budget under the contractuals by about $260,000.
From 16, or the 2017 adopted to 2017 amended,
Right.
that's where we consolidated all of the services. So if you
Oh,
look
okay.
further on, these ones where we had money in them last year, when we came to budget, they're down to zero now.
Gotcha.
So they're all consolidated into just this first and second page. The first one being Hamilton County and the second one being Warren County.
Someone explain to me why we do Hamilton County's Office of the Aging.
What'd you say, Claudia?
Why we have Hamilton County.
Why are we responsible for Hamilton County's Office of the Aging?
Dee?
That was an agreement that took place a long time ago, where we would just, they were consolidated. We are the only entity in New York State that has 2 counties underneath it.
Really?
All the other ones, they have their own counties, or their own county has the budget. I think it's because Hamilton County was so small that they, at some point, decided to consolidate them to, I think, minimize the efforts or the costs.
Shared services.
Well, that's true. Well, it said shared services, and that's definitely what it is. Right?
Sure. But I believe it was back in the 1970s when it was consolidated. I have the contract back in the office, I don't have it in front of me.
And is that why, like with the community action, it says Warren, Hamilton County Community Action? Because that's all part of that, right?
Yes.
Yes, Claudia?
Community Action is a separate nonprofit, though. A nonprofit organization. But they
But
have
it's
the
still the
same
2
training
counties.
rules.
I guess that was my question.
Yeah,
too.
I don't know why they do that either.
Well, like SAIL, the Southern Adirondack Independent Living Center, they actually group Hamilton, Warren, Washington, and Saratoga counties underneath the SAIL, the Independent Living Center in this area. I don't know why they chose to do it. I wasn't probably even born at that point.
Any other discussion as far as the budget goes? It is a bit confusing, especially when they went from like 12 to 2. It's kind of hard to do the comparison, really, so. Maybe
This
next
year
year will be
we're-
easier.
Yes, next year should hopefully be a lot easier, but we do have, within the office, we've done the breakdowns for each different program and the
Right, I see
100,
that.
200, 400, so that we can compare it that way.
Good. Okay, Claudia?
All right, thanks. One more. I guess it's just a generic question. If the state is cutting all this funding, are we planning on cutting the programs, or are we going to try to cover it as a county?
Well, the one program, the Direct Care Workers Program, that was, I believe, from my understanding, was developed to give all of the direct care workers a salary increase. So we did use that with the budget increases or the salary increases we had in 2017. But as of, I think it was July of this year, they're no longer having that program. With the New York Connects Expansion and Enhancement Program, with that program, even though the funding was cut over $100,000 from 2016 to 2017, we only have 1 staff person that we hired for that position. If that funding is cut altogether for 2018, that position will be eliminated. Okay. But all the other expenses that we have, they've been in existence except for the 6 positions that were added in August of 2016. So that's one of the things we're going to be looking at.
Okay, so that's not as drastic as it sounded at first.
From 17 to 18, it really isn't. It's just the reduction in the funding sources. But we are working with the budget committee. We're going to look to try to reduce some of our expenses so that it won't be such a drastic increase.
Okay, if there are no more questions, we'll thank Dee and let her go back to her.
And if you have more questions on it, feel free to come over.
Okay.
I'm still learning it all myself, but we do have a bunch of spreadsheets so we can kind of look at it from year to year
Right.
and see how it trended.
Okay, thank you.
Because I came up, I remember a couple days ago, probably never did it.
One more?
We did pretty good. We're moving right along.
These guys up in Bolton?
Yeah. Well, Montesi, I don't know where he is. Matt McDonald might be at work. He's having a hard time getting out of work to come to meetings.
So that's really, yep, maybe that's what we're talking about tomorrow.
That's the only one. It's just you, me, the 3 of us, and Ron.
Morning.
Welcome back. Good. That's what I thought it was.
Okay,
In case
Oh.
Warren's workplace.
Time now, about you.
Time again, huh?
Good.
or countryside. Boy, you're in Hague early this year. Wow, except you're afraid there'll be snow. Oh, I gotta remember to be there on Thursday.
There were caramel and Lindsay candy dishes.
Oh, municipal center's a month early too.
Well, that's what I said, they all seem early, don't they?
That's okay.
Good morning, ladies. Seems like they're so far down there.
No.
Okay, we're ready, Pat.
Don't dare get closer.
Right, okay.
First thing on our agenda this morning is to request a resolution to authorize acceptance of funding in the amount of $2,000 from Adirondack Rural Health Network, which is part of Adirondack Health Institute, and that is what we talked about the last time we had a meeting. That's to cover the cost of the vehicle wrap, which Dan is in the process of getting quotes for. And it's turning out to be a slower process than we expected, but we'll get there. So at least we have the money, so
That's
we'll
good.
get all that squared away.
Right. Someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Bramer. All those in favor?
Aye.
Opposed? Carried.
Do we need to do minutes?
No, because it's all part of the,
The one
Yep.
goes off.
yep.
Okay, moving on, for budget transfer and budget amendments, you'll see the copies that were transmitted with your information, and Con, if you want to just review why we need to do those.
Well, the one you just talked about for the Adirondack Rural Health Network, just to let you know, that's attachment number 6, showing the 2,000 coming in through health education as revenue, and 2,000, we put it under advertising because it's going to be the wrap on the car. And attachment number 5 is our budget transfers. I have 4 for the month. The first is to move money from our full-time salaries to our part-time salaries to cover the per diem in our home care, and that's $33,000. The next one is our preschool program, that money from there over to our early intervention program, where we have a EI coordinator who's another service coordinator who's helping out in that program and helping with the family health, children's special health care needs grant. So since we have someone moved over there, she's also got to have the money moved over there to cover that. Our third one is our bioterrorism, our grant, and it goes from July 1st to June, so the new grant started July 1st, and we just need to move some money. We saved in some part-time salary down to the supply line. This is fully funded by the grant, and I've already asked the state for this to move this money. And our fourth one is a nurse that we had that retired, and she has come back per diem, but her retiree health insurance, we have to move from basic health insurance to retiree to cover that to the end of the year. The total is $47,240 that I've asked to move.
All right, someone like to make that motion? Supervisor Bramer, seconded by Supervisor Leggett. Any discussion? All those in favor?
Aye.
Opposed? Carried.
Okay, moving on to pending items, if you recall, at last month's meeting, we did some talking about Lyme disease and other tick-borne prevention efforts, and I was requested that I have a talk with Jeff Tennyson, which I did, regarding how much prevention education is done with the employees who work outside in potential risk areas, and whether or not trails are appropriately marked, and if spraying should be done anyway. He was very confident that they're doing a lot of prevention education with their people, and he doesn't feel that spraying is indicated, wouldn't cure the issue anyway, and it's something we're just going to need to keep doing. We're doing it every year. Moving on to information for discussion. Tom, do you want to talk about expenditures and revenues?
Attachment number 2 are our financials as of 9/19. Noted in the salaries, again, we stay consistent with our regular salaries are down compared to last year, and our part-time salaries are up, and that's because we're utilizing per diem. As of the 19th, we were 58.86% of our total budget of salaries, and last year at this time, we were at 69.11%. So definitely have gone down, and it's over $145,000 difference in savings right now for salaries year-to-date. And attachment number 3 is comparison between last year at this time to this year. And again, you'll see that the salaries are down. Equipment, we had purchased 2 cars already this year, so that's for that difference. Contractual has finally gotten smaller now, and more of the invoices we caught up and got all those in that we needed to. We needed approvals from state before we could process them. And our employee benefits right now are showing down $60,000, and again, that's due to utilizing our per diems and saving on some benefits there.
For over $200,000 total then. 205.
I'm sorry, what was that?
Oh, between your hundreds and 800s, the reduction.
The total, yes, right now we're down, you mean the 223,485? Comparing it? Yeah. Yep.
And, or the 145,000 and 60,000.
Oh, you're saying between the salaries and fringe, yes, over $200,000 right now. Yep.
Big reduction.
And that again is, like we said, you know, a big change in when you utilize the per diems. And we talked about, which I'll talk about in budget too, but Val can explain it too, is that, you know, if referrals are down, then we don't call in the per diems. That's the nice thing about that, is that, you know, we can save on that salary expense and a little bit of fringe there because we're not paying them, obviously. And then our full-time are handling the cases that we currently have.
Questions? No. Moving on to,
Claudia, I'm
Sorry, is caseload going down? Like, are we in a downward trend?
They go up and down. It just totally depends on what's going on in the hospital.
Right. And the referrals we get from the hospital?
The majority, and then we also get from Hudson Headwaters, and Iron Gate, any of the physicians here. We do get from St. Peter's, Albany Med. We have gotten more over the last couple of months from those bigger hospitals, because the other home care agencies are unable to get right in, and we are.
moving on to the emergency response and preparedness report. You see attachment 1 for the monthly report. Do you have any questions on that? On to referrals, and Val and Tammy, if you want to comment on that. It seems like we've had a little bit healthier summer for the last month, but the last couple of weeks it's picking up. So, you know, who knows? Like Val says, it ebbs and flows, but the per diem is good because we don't have people sitting around. We don't.
We did call off per diems for the last 2 weeks. Friday they started picking up. I did check with our liaison at the hospital, and Glens Falls Hospital has been very slow, and I guess there's been some staffing changes that's gone on at the hospital. And the other thing is the hospital really has to be careful now. So they have a lot more patients that would have originally been referred to us, but that are going to rehab as opposed to going right home because they're just so sick. Insurance doesn't want to pay, you know, for them to stay in the hospital, but yet they're not well enough to go home. And for every patient that comes home, if they go back in the hospital within a couple of weeks to 30 days post-discharge with the same exact diagnosis, the hospital gets, you know, there's penalties to the hospital. So more patients are going to rehab. So it's like we'll get a referral called in from the liaison, but by the time that patient's ready to be discharged from the hospital, they've sent to rehab. So, you know, between the changes it's gone, I think they're currently going on in the hospital emergency room and stuff like that. But patients are...
Do we ever pick up after they get done with rehab?
Yeah, yep.
But it's just that amount of time.
Yeah, and then sometimes they're in rehab and then they don't need us by the time they're done. You know, and you have so many more patients now that are involved with managed care.
that's managed care. When they call for authorization, managed care may say to them, we're not paying for home care because we've already paid you for extensive rehab. So that's, it's not as simple as your Medicaid and your Medicare patients anymore. And even our Medicaid patients are now going into managed, everybody's trying to, save the dollar. So,
Sometimes that's good and sometimes it's bad, because sometimes people really want to get home and probably shouldn't. And so it sets up a more, a safer discharge plan if they keep them just a little while longer, particularly if people are 95 years old. Out at home. So it's kind of a catch-22, but I think if you look at the overall best thing for the patient, I think if everybody's kind of on the same page with that, it's a good thing.
And the other thing is they have a physician that oversees the referral, the patients that are admitted into the hospital, and he reviews the criteria of admission based on the documentation that is supported to them. And so we've had patients that we'll see, they go into the hospital, they're listed as an admission, and then 2 days later they're bounced out to an observation. So when we see our patients that's been admitted into the hospital, when they come home, they come home to us as another referral. Okay, so when you look at your amount of referrals, the hospital, a lot of these patients are not admitting, they bounce them out to an observation. So since they're only an observation, when we do get them back, but they don't count as a referral. They just count as picking up where you left off.
Okay.
So in a way, those referral numbers are not really accurate because of that. And then we've all, the patients in the hospital, they may, do an appeal process because the hospital case manager is saying your insurance isn't going to pay for you to be here. And then you tell the family that and then say, well, so you will be responsible. Of course, the family's going to take the patients home. And we've had 5 or 6 over the last month who come home from Glens Falls and are now going to Saratoga Hospital and being admitted. So I'm not sure what's the difference. I mean, they all have hospitalists and they all have a physician that's overseeing the referrals, but for some reason, Saratoga Hospital is admitting and not having them observation, but I don't know what goes on there.
All about money, probably. Somehow, right?
And I think it's, it has to be just how it's being written up. When you're looking at it, what information is being said, that in one hospital insurance will pay, and in the other hospital, no, they're not going to pay.
Best thing that's happened is don't get sick.
I guess that's true.
No pun intended there. You didn't tell about our award, Val.
Oh, I forgot. We did get an award from our, it's called our SHIPS, and that stands for Strategic Health Care Programs, and it just says that they were very happy to inform Warren County that we had been awarded a SHP Superior Performance Award for achieving an overall HHCA HPS, and you may know what all those initials stand for.
Sounds really good, though.
It does, wow.
But we ranked in the top 20%, and that's an excellent award that they did send us.
Oh, that's wonderful.
And it's based upon our home health patient satisfaction questionnaire that goes out.
Very good. Great.
The more letters you can put with it.
Right, exactly.
Okay, moving on, regarding staffing update, we haven't had anybody resign or retire, anything like that, so that's looking kind of optimistic about that, and we are looking for approval to backfill 2 positions. We still have a couple out there, but we have been able to recruit nurses who are looking to join our staff. The appropriate forms have been completed and transmitted, but we need to get approval from the committee.
Okay, so we need a motion then to do that, to give approval for that. Someone like to make that a motion. Supervisor McDevitt, second by Supervisor Leggett. All those in favor? Oh, wait a minute.
Sorry,
What?
what is it? What is this for?
It's to backfill the 2
Right.
positions, so.
I can never remember if we have to have
If we have what?
committee approval for the backfilling and the...
Right.
Okay.
I have, you're not alone.
Greg, question? No, okay. All those in favor?
Aye.
Opposed? carried.
Okay, now here's another one where I'm confused. This is the first time that we've had people go into conferences that we don't have to, we just have to inform the committee what's going on as long as we have money in the budget to pay for it.
Right.
So in that respect, Janelle is planning to go to the New York State Association of County Health Officials Annual Public Health Leaders Summit in Clayton in October 4th to the 6th. Tammy is planning to attend the Home Care Association Corporate Compliance Symposium in Albany on October 19th. And Jolie Novaka, who's a WIC nutrition facilitator, has already attended the lactation counselor training course in Plattsburgh. And we had all of the, like I said, authorizations were completed and monies are available.
Good.
Okay, regarding the rabies program report, our new plan continues to go extremely well. We did put the attachment for the whole year for up and through August. The next three are not due until the end of September. So you've got two reports, and also the rabies clinic schedule is there. We are working with IT to try to change the way the reporting is going to be done on our computer so that we have a different way of, now that public health is doing a lot of the follow-up, you'll just see a different format with the way the report comes out. But for right now, we've been doing it again so we were positively sure everything was going to work out, which it has. So if anybody has any questions.
Are these animals that were bit, and what are these reporting?
They did bite.
They were the ones doing the bite.
biters. Yep.
Okay.
And then the rest of it is whether or not we had to provide any post-exposure prophylaxis, and then there's also, we didn't have a lot of rabid animals, thankfully, this summer, but the number of specimens that were sent.
This one only goes through June. Just if you can bring us up to
Right,
date
because
next-
July, August, and September is the
Are
next
together,
one.
okay.
Right, so that's why I said we're kind of right on the cusp, but we didn't want to mess up the way that we're doing it,
Yeah.
so we'll bring that next month.
Great.
Budget, I guess, is that what's next? Budget, is that what we're quickly
Yep,
going
budget is what you're all here for, Todd?
But if I
Yes.
may ask, so about the bites then, our town animal control officers are working with your department?
The animal control
right?
officers that we hired to do the per
Yes.
diems, yes.
Yep. Okay, and that's
Yeah.
all coming out well?
Doing, never say wonderful, but it's really doing
That's good.
Okay.
extremely well.
That's good.
Yeah. And it's certainly extremely cost effective for
Oh,
everybody.
I would say.
Good. And, okay.
Don?
Okay, regarding 2018 budget, this long sheet of paper that you have that's color-coded, that is the summary of all of our programs and the effects, bottom line, to what we're anticipating. Some of the highlights that I wanted to discuss was, first thing to say that the WIC and the bioterrorism grants are fully funded by the grant, so we don't have any impact to the county on those. And one other thing we did do is we changed our senior public health educator. He was doing 60-40, 60% in health ed, 40 in bioterrorism. We felt it's more appropriate. We've already done it with the bioterrorism grant and changed him from 70 to 30, 70% in health ed, 30% in bioterrorism, because he's going to have the liaison working with him in that grant still. So we've changed that. The orange line that you see here, the peach, that's what we call all our salary changes. So like the health educator switching from 60-40 to 70-30, those things are all in that orange line. Another thing in our preventive program, the mandated, our public health director and medical advisor, and those total expenses are $147,544. That's again already in here and included in fringes, just to give you an idea of what's mandated. Nothing we can do with those. Those are already given. The other mandated programs are our disease program, our preventive program, our preschool program, and our early intervention program. They total $4,294,049. And the total technically with those. With our preschool and our EI, we get like 49.5 cents on the dollar. So with the mandated with the EI and preschool programs, those we already know are a cost to the county. The total cost of that is 1.8 million, a little over that, or 80% of our total loss that we have here is those mandated programs. What else was I going to say? I did want to bring up too a big portion of our budget, and it hits our home care the biggest because that's where most of the employees are, is the retiree health, which I went back. We started getting that adjustment sent to us each month back in 2012. So it wasn't reflective back in years past. It is now. But it's kind of hard for me on a budget basis when we got a lot of people now who are retiring, that retiree health is up there. And then when you have to replace a nurse, then you have to pay their health, so I'm getting kind of double hit. Not we. And I take it kind of personally though, but the total retiree health is $284,000. So if you consider
Where's that line?
Yeah, where's that line?
Retiree, that's the last line I wrote it. in the notes.
Down in the
But
notes.
it's part of, it's part of the fringe portion of the whole thing.
Where is that?
Where is fringe?
Yeah.
Well, it's included in the whole under expenditures, under where you would say amount of total appropriation.
Okay, so it's just part of the...
It's part of the total,
Program.
right, just like health insurance and dental and all the taxes and everything that we have to meet. But I emphasize the retiree health because as that keeps going up, which like I said, and then I was told afterwards, because we did have someone just retire this summer, that's not in these numbers yet. So I had already submitted my budget. I already know that's got to go up again for this one person that just retired. So, like I said, $284,000 right now, it's probably closer to $300,000 now, is just retiree health. And that's nothing I can do about, we try to make sure, like we said, we utilize our per diem so that we don't have to overexpend on our salaries and keep in fringe and everything, but that's nothing. So that's a big impact to my bottom line. I mean, that would bring me under budget or quote, yeah, probably under budget from last year if the retiree health wasn't in there. But I'm just emphasizing that because that is a big expense. Some of the other things that aren't included in here that we could not do, revenues that we can possibly earn, COLAs. The only one that a COLA, which is a cost of living adjustment, we get that from the state, usually from the public health side. Our WIC program, it's like around $42,000. They have now included that in the budget with the state. So I do know that's approved and I can now include that in here. But all our other grants, those COLAs are not in here yet. So during the year I asked to amend the budget to increase. So you will get some extra revenues with those. Right. So like if a grant, we just, it's a small grant, we just apply salaries, well then I would go and take the COLA and try to apply fringe. Any way I can get money, whatever I can do to utilize that. So those are things. The other projects and stuff, which Tammy can explain, our DISRIP, with this year we asked to adjust the budget for $45,000. I don't know if you want to explain what DISRIP is.
Well, those are the ongoing projects we're doing with hospital rehospitalization, our hospital at home project. We're involved in a palliative care project. And based upon milestones that you meet, you're eligible for funding that's flowing through Medicaid to Adirondack Health Institute. It's part of that why you had to sit through that riveting Medicare Medicaid compliance stuff. Riveting,
Yeah,
that's right. So, but we'll continue. On a quarterly basis, we have to report on engaged patients, and an engaged patient is a patient that, a Medicaid or dually eligible patient, Medicare, Medicaid eligible, patient that we see in home care, that because we do what we do, and we do what we do well, we're keeping them out of the hospital. So if we do, we get a certain amount of money per patient. So we're reporting that on a we report that on a quarterly basis, and the money flows from AHI through us. We also have other potential revenues. There is a state grant that we would be eligible for. Once we're starting in October, we're going to be transitioning our current medical record, same vendor, new product, to new product that has more interoperability with other products. Like we can submit data, not patient-specific, or declass. I should say it is patient-specific, but all the identifiers are removed from the data.
And we submit that so that, you know, a doctor's office could see if they had a home care visit. At this point, there's like a $10,000 grant that you're eligible for, but we're not eligible for that until we make that transition. So as projects come up, Val and I and Janelle, we're very involved, and we just went to a conference with AHI. As these projects come up and funding is available, we certainly try to get as much funding for the projects we're involved in as we can, but we simply don't know what that's going to look like from year to year, so we can't include it in the budget.
So is there a cost to get up to speed in order to get that 10,000?
We actually, last month, we discussed the fact that we're going to use the funding we received this year for district funding to pay for the transition from our current product to the new product.
Just another incentives that we get from the state, depends on reporting to state. Most of it is public health, where we have to report certain things, which, like you say, is part of the norm, but you do get a little yay and get a little extra money for that. If we report 100% of our like chronic diseases or STD clinics, we've gotten money on that. Could go from $10,000 to $12,000. And again, those are monies I can't put in here yet, but I will amend the budget throughout the year, but that's extra revenues. As we keep doing the good job that we do, I can add those along the way. So those are extra revenues that we're going to see, you know. I mean, I think it was $45,000 this year we put in for DISREP, and we've already utilized half of that. We're going to do some more. We've got, I saw. So, you know, and next year, whatever we get. Going kind of down each program a little bit, the biggest program, or one of the is our home care. And first of all, saying that we have savings because we have per diem, that 65% of the estimated cost to the county, of that 65% of that, now it's going to be a little bit more, is just the retiree health. So that gives you an idea of what a big chunk of change that is. Savings on postage, that was a big thing. Thank you, Val. She found out we were mailing orders to doctors to have them signed. We had to wait for them to get back. Then we would put them in, and she found out we don't need to mail them anymore. We can just fax it, and then we get it back via fax. Quick. We're saving, and I've reduced the postage went from $7,000 down to $1,500 is our guess.
Wow.
And so right now we're like at $700 so far year to date. So that was a big savings for us this year.
I'm surprised it
Next year.
hasn't gone to fully electronic. You still have to fax.
I'll have to fax. But I don't know if that's going to change down the road with anything, with the new update. I'm not sure.
I mean, we'll certainly look into an automated referral form potentially, but that has to be specific to all of your referral sources. So the most reasonable referral source to look at would be Glens Falls Hospital, especially since we have our hospital liaisons that are right there. We have our 2 full-time employees that are right there at the hospital. They look at all of our referrals. So there's potentially the ability to do some of that. But we still get, you know, as far as doctor's orders and things like that, we still get those out to doctors because we need a signature on all of our orders in order for our nurses to go out and provide care.
One other thing I just wanted to bring up was we're working with the county attorney's office on a certain insurance company that they're supposed to update their rates with us every year based on their Medicaid cost report that CAM does and get it, and they haven't done it since 2014. We've been 2.5 years fighting with them, and we keep saying we're going to contact the attorney, and we finally did. And thank you, Mary. She's been working with us, and she sent them a letter, and we're hoping that's going to be about $60,000 back that they owe us going forward, start paying us at the correct rate. So my billing person's really on top of that. We've got to make sure we get our contracts updated, make sure everything is good. So that's good extra revenue, again, that we might see, and hopefully we'll see. Work on that. Another thing is that Tammy worked very hard on returning our telemonitors. They're not being all utilized, but yet we paid a monthly maintenance fee. Am I right on that? And the telemonitors, so the ones that, you know, we've got our stock that we need, but why are we paying maintenance if we're not going to use them? So she got that worked out with the people, and now that's reduced. So that expense has gone down in the budget.
Why aren't we using those?
We do, you know, when we received the state grant, we purchased, it's about almost 100 different monitors, and for some diagnosis, they're more appropriate than for others, and I think that a lot of it is getting buy-in from patients. We need to continue to do that. The reason we weren't using all of them is some of them, we've had them now for 10 years, so some of the connectivity has been outdated. The ones that we're currently using are our digitals, and they're still working. But it seems, what I did is I did a 3-year analysis on the total number of monitors that we would ever have in the field at a time, and we didn't go really above 30. Even though we had 100, we really didn't, we might have 30 in the field. So it made more sense to keep 30 and keep them up and running. And we still have them. We can always reactivate them. And there's a small fee to reactivate them. We have them, we're storing them actually we have storage under the old jail. And we are storing them if in the event that we ever had to reactivate more. But with our nurses that we have and concentrating on certain clientele with certain patients with certain diagnoses, it makes more sense than having them sit on. So we really looked at that. And, so that's what we're doing. So now we have 30 monitors.
Some patients' reality don't want to be monitored that closely.
That is true.
Because what happens is you put the monitor in, and if they are not really good on their diet, it shows up immediately and they get a call. And I think that there were a number of people that felt Big Brother was watching a little too closely. You know, if they decided they wanted to eat bologna sandwiches and canned soup, which we know is loaded with sodium, it's kind of like it's a choice. We can offer it to them, and they can say yay, or it used to be they'd say yay for a very short period of time and say, I don't like this. And then, so again, being able to be welcome in their home and be able to monitor their condition is way more important than to force something on them they don't want to do.
True.
Okay, onward, I'm going to discuss family health. We had 3 full-time nursing positions in there. 1 retired last year. She came back per diem. We have the coordinator that's come over to help with the grant there, and this person also helps with the Children's Special Health Care Needs grant. And we have a new part-time per diem nurse that's been utilized. So what we've done is we've eliminated 2 full-time nursing positions, and we still have 1 in that department, and we have the 3 per diem. So again, cost savings, we've got fringe benefits that we're saving there, and they're able to be utilized what we need for at this point with our MCH program. So that's worked out well. Our disease program, the big thing which came up this year but continues is that we've added the animal control positions. When we asked for it this year, we didn't ask for any money. We just took it out of our per diem line and created these positions. So one of the things I've just asked for, we put in $4,500. This will be it started really in June or July, I think, is when, so we don't have a full idea of what, but we budgeted for $4,500, so I just reduced the per diem line by $4,500. So again, no impact, but again, it stayed the same. We didn't need to ask for any more money. We've also asked for a supervising position that we have on our home care side. We want to move it to our disease program and utilize that person for the public health side and the home care side, and by also moving it over to that department, because it's going to be used by everyone, we can claim state aid, which is one of the big things we're always looking at, is what's our best bang for our buck kind of deal. So that's one of the things we really want to do, and we really need that position filled. The other thing is with the new contract, they changed call pay rates, increased call pay rates, and one of the grants, our BT grant, had a call pay, and we've eliminated that at this point. That's $7,800, so we took that out. Pat and Janelle are primarily taking that call without being compensated. They're at this point doing that on their own time, so that is no longer in there. We've eliminated that position.
So call pay is, what's call pay?
We used to receive money after hours to compensate us for carrying a pager, beeper, cell phone scenario.
So it's that
and now
call.
we still have the cell phone, but we're not getting compensated, but we're just covering the calls as they come to enforcement.
Gotcha, thanks.
And they also add to that, we do have call pay, obviously, with our home care because of emergencies with situations. So, again, with the contract, that increased, so we had to recalculate that, and we had to add in more money in that respect to cover that additional call pay for next year. It's in this year, but I'm assuming and I'm sure, because we are below budget, that any extra money that we have in full-time is paying for that extra call pay that was effective this year. So we should make it to the end of the year just fine this year. I just wanted to make sure I made that. What I did with the budget was I also increased the per diem line that it seems like it's running low, but now that we've been utilizing our per diems, trying to increase that so I don't have to come every year. Trying to make the budget look a little bit smoother by removing the call pay, increasing the CHOP call pay, removing this call pay. We just try to make all those adjustments as best as we could. The health that I already explained about Dan, our preschool program is where, like I said, the service coordinator that's partially there, she's now helping out with family health, so we just had to make sure that money is compensated for her. We did increase, because she is now helping with the one grant, we did increase one of our per diems, and we eliminated our per diem line, and she is now a position within the budget in our early intervention program. So we were able to eliminate a $10,000 line there. One thing that we also, the big thing is that we have a position, we'd like to, senior health educator, we'd like to add. This person would best be utilized again for both, especially like you were saying, and one thing I thought of was the, like you said, rehab sending us referrals. Yes, we do get some, but we really don't have a marketing person, or, you know, and it would be great to have somebody who can go out and do all that for us. And we feel we'll get more referrals than we will get, you know, for those who know us. And a lot of them already know us, but, you know, get out there and get marketing, and this person is going to be utilized by both sides again. So we've, again, one of the nursing positions we eliminated will, again, go towards this person. So we're not asking for any more money. So the bottom line is all our payroll adjustments are $69,783 to the negative. So we're taking that out of budget, reducing budget by that with all the moving and everything. So I think we've done a good job there. I think that's all I have.
Any questions? Good. Ladies, you did a wonderful job. We appreciate that.
Love your spreadsheets.
I like the color code.
No, I think this is a very good way of doing it for us. It makes it a lot easier. I'm sure. All right. No questions? I guess we could adjourn. I'll entertain a motion to adjourn. Supervisor Leggett, seconded by Supervisor McDevitt. All those in favor? Aye.
Aye.
Opposed? Claudia, are you good? Are you going to make whatever you have to make, or?
Nope, it's over.
Oh, I'm sorry.